Cynthia lay on her bathroom floor at 2 in the morning, unable to move the right side of her body. Her cell phone sat on the counter, just 18 inches away. It might as well have been a mile. She tried to call out to her daughter sleeping down the hall, but the words wouldn't form. Only garbled sounds escaped her lips. 3 weeks earlier, she'd had her first warning. 2 weeks ago, a second chance. 1 week before this moment, a final opportunity. She'd ignored all three. Cynthia is 52 years old. She's an office manager, a mother, a daughter caring for aging parents. And she almost died because she thought she was just tired. If you or anyone you love is over 40, you need to watch every second of this video. What you're about to learn could save a life. Maybe even your own. Hit that like button right now, because the signs Cynthia missed are the same ones millions of people ignore every single day. 3 months before that bathroom floor, Cynthia's life looked perfectly ordinary. Maybe too ordinary. The kind of busy that's become so normal we forget it's actually exhausting. She managed a medical billing office with 12 employees, juggling insurance claims, personnel issues, and endless administrative demands. Her 2 kids were in college, one graduating, one transferring schools, which meant constant planning, financial stress, and emotional support from a distance. Her father had just been diagnosed with early dementia, and her mother needed help coordinating his care appointments, medications, and a million small details of managing a chronic condition. Cynthia was the person everyone called when they needed something. The reliable one, the capable one, the one who always figured it out. Her own health? That came last. Always last. She couldn't remember her last physical exam, maybe 3 years ago, 4. Her doctor had mentioned something about her blood pressure being a bit elevated and suggested she come back for a recheck. She'd meant to schedule that follow-up. She really had. But work got busy. Then the holidays came, then her dad's diagnosis, and somehow 3 years passed. Do you know someone like this? Someone who takes care of everyone except themselves? Someone who's always too busy for their own checkups? Keep watching, because what happened to Cynthia is more common than you think. Warning sign 1, the episode at work. 3 weeks before the stroke, Cynthia sat at her desk reviewing quarterly budget spreadsheets. It was late afternoon, that exhausted, brain-foggy time when you've been staring at numbers too long and everything starts to blur together. Suddenly, the room tilted slightly, not dramatically, just enough to make her grip her desk edge. Her right hand felt strange, heavy, foreign. She tried to pick up her pen to make a note, and it slipped from her fingers, clattering onto the keyboard. Her colleague Sarah walked over with a question about a denied claim. Cynthia opened her mouth to respond, but the words wouldn't come. Not gone entirely, just scrambled. She knew what she wanted to say, but the connection between thought and speech had momentarily short-circuited. Sarah looked concerned. "You okay?" And just like that, it passed. Maybe 90 seconds, start to finish. The room steadied. Her hand felt normal. Words flowed again. "I'm fine," Cynthia said, laughing it off. "Just exhausted. I need more sleep." She took 2 aspirin from her desk drawer, drank some water, and went back to work. She mentioned it to no one else. Why worry people over nothing? But it wasn't nothing. What Cynthia didn't know, what she wouldn't learn until it was almost too late, was that she'd just experienced a TIA, a transient ischemic attack, a mini-stroke. A TIA happens when blood flow part of the brain is briefly blocked, usually by a temporary clot. The symptoms can be identical to a major stroke, but they resolve quickly, usually within minutes. Because they pass, people dismiss them. Just tired, just stressed, just need to rest. Here's the terrifying truth. About 1 in 3 people who have a TIA will go on to have a major stroke, many within days or weeks. A TIA is your brain's alarm system screaming at you. It's your warning, your chance to prevent disaster. If Cynthia had gone to the emergency room that afternoon, if she'd taken those 90 seconds seriously, everything that followed could have been prevented. Warning sign 2, the headache. 2 weeks later, Cynthia woke at 5:30 in the morning with a headache. She got headaches sometimes, Tension headaches from stress, usually settling behind her eyes or at the base of her skull. She knew how to manage them. Ibuprofen, water, maybe a heating pad on her neck. But this one felt different, more intense. The pain centered on the left side of her head with sharp, pressing quality she'd never experienced before. She sat up too quickly and her vision went strange. Not exactly blurry, but color seemed oversaturated and wrong for a few seconds. The room swayed slightly when she stood. Cynthia took 3 ibuprofen and forced herself through her morning routine. She had an 8 o'clock department meeting she couldn't miss. By noon, the headache had faded to a dull background ache. By evening, it was gone. She told herself it was stress. Her father had another doctor's appointment coming up. Work was understaffed. She needed to plan her son's graduation trip. Just stress. Just life. What she didn't know. Sudden, severe headaches that feel different from your normal patterns can signal vascular problems. Issues with blood vessels in the brain. Combined with vision changes and dizziness, those are red flags demanding immediate medical evaluation. This was her second warning, her second missed chance. How many of these signs have you ignored in yourself or someone you love? Drop a comment if this is hitting close to home, and make sure you're subscribed. We're about to cover the signs you absolutely must know. Warning sign 3, the face tingling. 1 week before the major stroke, Cynthia stood at her bathroom mirror applying makeup before work. A tingling sensation spread across the left side of her face, like the feeling when your foot falls asleep, but on her cheek and around her mouth. She touched her face. The sensation was there but muted, like touching skin through a layer of gauze. She tried to smile at her reflection to test whether everything was working. Something looked slightly off. Subtle but wrong. Was one side of her smile weaker? She blinked, looked again. Maybe she was imagining it. The tingling faded after about 5 minutes, and her smile looked normal again. Must have slept funny, she muttered, finishing her makeup routine. That evening, her daughter Emma noticed her rubbing her face. "You okay, Mom?" "Oh, just had some weird tingling this morning. Slept in an awkward position, I think." Emma frowned. "That's been happening a lot lately. You should probably get it checked out." "I'm fine, honey. Just tired. I'll rest this weekend." Famous last words. This was her third warning, her final chance, and she waved it away like a mosquito. 4 days later, at 11:15 on a Tuesday night, Cynthia sat at her kitchen table finishing up quarterly reports. Emma was asleep upstairs. The house was quiet except for the laptop's gentle hum. The headache came first, sudden and crushing, like someone had clamped her skull in a vice. This wasn't stress. This wasn't tension. This was wrong. Cynthia pushed back from the table to get water. As she stood, her right leg buckled. She grabbed the chair back, confused. Why wasn't her leg working? She tried to call for Emma, but what came out wasn't words, just garbled, nonsensical sound that frightened her more than the pain. Panic rising. Cynthia made her way toward the bathroom, dragging her right leg, using walls and furniture for support. She needed to see herself, needed to understand what was happening. The bathroom light was harsh. The woman in the mirror looked wrong. The right side of her face sagged like melting wax. She tried to lift both arms to touch her face. Her left arm raised normally, but her right arm barely moved, heavy and unresponsive. She tried again to speak, to call for help. Not words, just sounds. Her right leg gave out completely. She fell, hips slamming into the bathroom counter on her way down. The crash finally did what her voice couldn't. It woke Emma. "Mom!" Emma's sleepy voice from upstairs. "Mom, you okay?" Footsteps running. Emma appeared in the doorway, took one look, and her face went white. "Mom! Emma, what's wrong?" Cynthia tried to speak. Nothing intelligible emerged. Emma, to her credit, didn't freeze. 6 months earlier, she watched a health segment on morning television about stroke signs. She'd even mentioned it to her mom, who'd said, "Good to know, honey," and promptly forgotten. Emma grabbed her phone and dialed 911. "My mom, something's really wrong. She can't speak. Her face is drooping on one side. She can't move her right arm or leg." The dispatcher's voice was urgent. How long has this been happening? I don't know. I just found her. Maybe just now. We're sending paramedics immediately. Stay with her. Do not let her eat or drink anything. Note the time. It's critical for treatment. Time is brain. The paramedics arrived in 8 minutes. To Emma, it felt like hours. They assessed Cynthia quickly, professionally. Stroke protocol activated. En route to Regional Medical Center, the nearest comprehensive stroke center. They radioed ahead. 52-year-old female. Sudden onset right-sided weakness, facial droop, aphasia. Last known well approximately 15 minutes ago. ETA 7 minutes. At the hospital, everything moved fast. CT scan to rule out bleeding. It showed an ischemic stroke, a blood clot blocking the artery supplying blood to the left side of her brain. Because Emma had acted quickly, because the paramedics had recognized the signs immediately, because the hospital was ready, Cynthia arrived within the critical window for treatment. The neurologist explained rapidly to Emma, "Your mother is a candidate for TPA, tissue plasminogen activator. It's a clot-busting medication. It can minimize damage, but we need your consent, and we need to give it now." Emma signed. They administered the medication. The clot dissolved. Blood flow restored. But the damage was done. The next morning, Cynthia woke in a hospital bed with weakness throughout her right side and difficulty forming words. She was alive. She could think clearly, but her body wasn't entirely obeying her brain anymore. The neurologist, Dr. Patel, came to evaluate her. Emma sat beside the bed, exhausted and terrified. "Cynthia, I need to ask you some questions," Dr. Patel said gently. "Have you had any unusual symptoms in recent weeks? Any brief episodes of weakness or confusion?" Cynthia struggled to form words. "Yes, at work. Drop pen." "When was that?" 3 weeks. "What happened exactly?" Slowly, painfully, Cynthia described the episode at her desk. Then the headache. Then the face tingling. Dr. Patel's expression was grave. "Cynthia, what you're describing are TIAs, transient ischemic attacks. Mini strokes. They're warnings." Emma looked stricken. She had mini strokes? Why didn't anyone? "Because she didn't tell anyone," Dr. Patel said. "And even if she had, many people don't recognize the symptoms. But here's what's crucial to understand. TIAs predict major strokes. Each episode was your body's warning system. Each one was a chance to prevent this. The tests revealed more. Severely elevated blood pressure that had likely been high for years. High cholesterol. A family history Cynthia had never taken seriously. Her father's stroke at 58. Your blood pressure was dangerously high," Dr. Patel explained. "Uncontrolled hypertension is the leading cause of stroke. Combined with high cholesterol in your family history, you were at significant risk. Those TAs were your brain saying, 'We have a problem.' If you'd sought treatment after any of those episodes, we could have started blood pressure medication, cholesterol management, possibly blood thinners. We could have prevented this major stroke." The words hit Cynthia like a physical blow. She'd ignored her body's alarm system 3 times. Critical education, the fast method. Dr. Patel spent time with Cynthia and Emma that afternoon, teaching them what they all wished they'd known weeks earlier. Everyone, and I mean everyone, needs to memorize 4 letters, FASD. It's the fastest way to recognize stroke symptoms and save lives. F stands for face drooping. Ask the person to smile. Does one side of their face droop or feel numb? Is their smile uneven? Even subtle drooping is significant. Don't wait for dramatic symptoms. If something looks off, take it seriously. A stand for arm weakness. Ask the person to raise both arms. Does one arm drift downward? Is there weakness or numbness in one arm? Can they hold both arms up at the same level? Even slight weakness matters. S stand for speech difficulty. Ask the person to repeat a simple phrase like, "The sky is blue." Is their speech slurred? Are they unable to speak or hard to understand? Do they have trouble finding the right words? Any speech problem, even brief or subtle, is a red flag. T stand for time to call 911. This is the most important part. If someone shows any of these symptoms, Even if they go away, call 911 immediately. Don't wait. Don't drive them to the hospital yourself. Call 911. Why? Because paramedics can start treatment en route and alert the stroke team at the hospital. Every minute matters. Every minute of blocked blood flow means brain cells dying. We have a saying in neurology, time is brain. Note the time symptoms began. Doctors need that information to determine treatment options. Dr. Patel continued. There are other warning signs, too. Sudden severe headache with no known cause. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden confusion or trouble understanding speech. And here's critical. Even if symptoms resolve quickly, like Cynthia's did those first 3 times, you still need emergency evaluation. Those brief episodes are TIAs. They predict major strokes. They're your warning, your chance to prevent disaster. Screenshot the FAST acronym right now. Share this video with everyone you know over 40. This information saves lives. Comment FAST below if you're committing to memorizing this and teaching it to your family. Cynthia spent 3 weeks in the hospital, 1 in the stroke unit, 2 in acute rehabilitation, physical therapy to regain strength in her right side, occupational therapy to relearn daily tasks, speech therapy to improve her word finding and articulation. She started a regimen of medications, a blood pressure medication to keep her hypertension controlled, a statin to lower her cholesterol, and a daily aspirin to prevent future clots. 6 months later, Cynthia has regained about 85% of her function. She's back at work, driving, living independently. But there are permanent changes. Her right hand has slight weakness. Fine motor tasks like buttoning small buttons or writing for long periods are harder. She occasionally struggles to find the right word, her brain searching for a moment before the word appears. But she's alive. She's functional. She's here for her kids, her parents, her life. And she has a new mission. Cynthia now speaks at community health fairs and senior centers. She shares her story to help others avoid her mistakes. Her message is simple but powerful. I ignored 3 warnings. Don't be me. Listen to your body. She talks about the "it won't happen to me" mentality, how she thought she was too young, too busy, too healthy for a stroke, how she prioritized everyone else's health except her own. I took my father to every cardiology appointment, she tells audiences. I researched his medications and tracked his symptoms, but I couldn't remember my own last physical exam. I had no idea what my blood pressure was. I'd ignored warning signs for weeks because I was too busy. Her story resonates because it's so relatable. How many people take better care of their cars and their bodies? How many schedule regular oil changes but not annual physicals? What Cynthia wants everyone to know: strokes are preventable. Most risk factors can be managed, but you have to know your risks, recognize the warning signs, and take action. Here's the truth. Strokes are medical emergencies, but many are preventable. Knowledge is power. Knowing the signs, understanding your risks, and taking action can mean the difference between disability and recovery, between life and death. The difference often comes down to minutes. What can you do right now? First, learn fast. Memorize it. Teach it to your family, your friends, your co-workers. Face drooping, arm weakness, speech difficulty. Time to call 911. Second, schedule a checkup if you haven't had one recently, especially if you're over 40. Get your blood pressure checked. Know your cholesterol numbers. Understand your stroke risk. Third, know your personal risk factors. High blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, family history. These all increase stroke risk. Most are controllable with lifestyle changes or medication. Fourth, never ignore symptoms. Ever. Brief episodes of weakness, numbness, confusion, vision changes, severe headaches. These demand immediate medical attention. Don't rationalize them away. Don't wait to see if they get better. Fifth, if you or someone else shows stroke signs, call 911 immediately. Don't drive to the hospital. Don't wait. Time is brain. Cynthia ignored 3 warnings. She almost paid with her life. You don't have to make the same mistake. If this video could save even one life, it's worth sharing. Hit that share button right now. Send it to your parents, your siblings, your friends over 40. Give it a thumbs up so YouTube shows this to more people who need to see it. Subscribe to ElderCare for health stories that could save your life or someone you love. And comment below. Do you know your blood pressure? When was your last checkup? Let's hold each other accountable. Recognize the signs. Take action. Save a life, maybe your own.